started. With today, we have Natasha Telger, who is with the Illinois WorkNet, and she's been working diligently on this program with us to get this up and running. She's going to do the presentation today on accepting SNAP clients that have been referred to organizations and how you can access these clients and view these clients through Illinois WorkNet. We're diligently working on the service side of this project, and so there's still certain parts that we're building out. But you guys are starting to get referrals now, and after she gets done with her presentation, I'll go through the list of numbers that have been referred. But we need you up and running, and we'll go through, like I said, the grant processing and everything at the end of her presentation. But I'd like to present Natasha, and she's going to explain how you get into Illinois WorkNet to view clients. Thanks so much, Natasha.
Okay, great. Thanks. Okay, to get started with, the first thing we need to do is make sure that you have access to the EPIC tools. And we have quite a few of you already that have access to the EPIC tools. But if you know there are other staff at your organization that need to have access, we need to go ahead and get them on board. So what they need to do is to go into Illinois WorkNet and set up their Illinois WorkNet account, and then send us an email to info@illinoisworknet.com and include their agency name, the staff person's name, as well as their email address. And we can go ahead and make them workforce partners and give them access to the tools. Now, this may be a repeat for some of you, but just as a reminder, before the customers actually are assigned to each of the CBOs, the DHS staff is going through an intake process. So the DHS is identifying and recruiting those SNAP recipients that are eligible to participate. And then as part of the intake process, they're completing an application and the NOCTI assessment. And that application includes some baseline assessment questions that were developed based on the baseline assessment requirements that you had provided for your training program. And then we use the NOCTI assessment just to get a general idea if they may need to have a program that has a bridge program. So, for example, if a person does not have a GED or a high school diploma, they're automatically sent to or recommended for programs that do have a bridge program. And let's say that maybe they have a high school diploma, but they scored really low on the reading, math, and writing part of the NOCTI, then they would still be recommended to training programs that have bridge programs. So whenever they get to you, I'm sure you'll be doing your own assessments, and but just to kind of let you know that that's just as a reference point rather than an actual TAPE score. So we don't know the exact grade level that they're at. We're just using that as general information to make a recommendation for a training program. So the information that you have been providing is being used in the upfront process. So then it leads to the next bullet point where the DHS and Commerce staff are reviewing. The system makes automatic recommendations based on the baseline assessments, some of the what we call hard stops, which you'll learn about more later, and then to see, are they recommended for a bridge program. So DHS Commerce staff are making recommendations based on all that criteria. And if the person is recommended for a training program, then they will go through the random assignment consent process. Once they go through random assignment, then they'll be assigned to either a control group, which is business as usual for them, or the EPIC services group or the treatment group. And that means that they will be assigned to one of you. So they'll go through and assign the customer to a training program, one of the training programs that was recommended, and the Illinois WorkNet system will notify the CBO staff that the customers have been assigned, and that will be sent out through an Illinois WorkNet message and to your email. We are going to have these sent out about 8 o'clock each morning, so that, and this will be from people that are being added like as of tomorrow and moving forward. Then you'll receive that notice, so you'll know who the new people are that are being added and assigned to your organization or to your training programs. The email will include the customers that have been added, and the next few steps. We do have, this is kind of a, part of these are short-term solutions because we are in the process of developing other tools that will move this process along. But for now, this is how you can access these customers. So what you'll do, and I'll demo this in just a minute, but I want to go through this. So what you're going to do is you're going to log into your partner tools, and you're going to go you're going to see a default list, which is the customers that have been appointed to you. And so what we need you to do is take a look at their information. You'll have their contact information, and then just to follow up with them to set up an initial appointment. And as part of that appointment, if a customer does not have an email account, we would ask you to help them create one and then log into their Illinois WorkNet account and update their information, because that's one of the ways that one of the tools that they can use to, for one thing, recover their password, but then also receive ongoing communication from you and from the system. One of the things that the customer is going to have is a 2151 form, and they will receive, they'll bring that 2151 form with them to their initial appointment, and they will need to you'll need to respond and provide that 2151 form or a way to follow up with them provide the information back to the DHS caseworker no later than 48 hours after the initial appointment. It doesn't mean that the initial appointment has to happen within 48 hours, but the follow-up does need to occur within 48 hours of the initial appointment. So what we will have is a progress page, and it's not currently available, but it will be. So that's what we'll use in the future, and I have a mock-up of that. But for the short term, you can upload that into their iStep. So let me go ahead, and I've covered quite a bit of that information already. So let me go ahead and do a screen share for what we've covered so far. So let me go into Illinois WorkNet. So you go to illinoisworknet.com, you log into your account, you click My Dashboard. Under your partner tools, you'll see the EPIC logo and link. I'm not going to click on this because it's production, but this is where you'll see it in production. Now we're in test. And so what you'll see when you come to your EPIC tools as a CBO, when customers have been assigned to you, it's going to default to the listing of customers that have been assigned to you. And so you can log in, see your list. You can click on their link to the customer information. You'll have access to their application information under their profile application information, and you can see their contact information. So you can contact them and just set up that initial appointment. You can also see that if they have an email address or not. If they don't have an email address, and the instructions that I just provided you, it tells, go ahead and help them set up an email account, and they will have to log into their Illinois WorkNet account and update their profile and all that kind of good stuff. So then when it comes to the 2151 form, you will, even in the near future, you're going to have a progress page. But as of today, we don't have the progress page in production yet. So what you'll do is you can click on the iStep stands for Individualized Services Training and Employment Plan. And we're in the process of releasing this and updating and all the services and all that kind of good stuff. So, so right now, what I really would just prefer that you just use this section just as a temporary solution for uploading the 2151 form. And you can go into the ISEP. You can really click any of these, but I just selected personal development as the first one. And then you can hit upload file and then browse to your computer to where you have the copy of the 2151 form and then upload it. And then that 2151 form is available in the system for that customer. Again, that's our temporary solution until we have the progress page available. Okay, we will be adding, let me get my pointer out here, you can add case notes in the ISEP as needed, and we will be providing additional information on using the ISEP because we really want to hone in on the activities and services and make those available for you through the ISEP that are really specific to EPIC. So we'll be doing some enhancements on that section as well. And we'll have another training on that. But just to kind of let you know what else is going on for the future, for the near future, what we have currently in development is an appointment calendar. One of the things that when the customer is going through the intake process, they've done that, they've gone through eligibility review, and they're with it sitting there at the table with the DHS caseworker. They're going to find out whether they've been assigned to the treatment group or if they are not going to get EPIC services. If they're going to get EPIC services, they'll go ahead and they'll identify which training program and training provider they're going to be assigned to, and then what we would like to do, and what the plan is, what we're currently working on, is to give them the ability to go ahead and set up that appointment at that point in time. Because with some of these folks, it's hard to get a hold of them, or because of their situations with their phones, or they may not recognize the number, so they're not going to answer the phone, or sometimes it just takes delay in mail, in the snail mail service. We just want them to be able to set their appointments up at that point in time while they're sitting across from the table from the DHS caseworker. So this is a mock-up, so you can see that they have been assigned to the EPIC services. They've been assigned to a program, and this is just a mock-up again. So we would have, if the person was assigned to Albany Park Community Center, then they would be able to see, oh, well, Albany Park, they have appointment times on Monday at 10, 11, 12, 1. Which of these times would work out best for you, or when can you make these? So they can go ahead and basically reserve or select their time for that initial appointment. So that's from the DHS view. From the CBO view, what we would just need for you to do is to go in and identify which times you're available, which times are open and will work for you. And then you can see the listing of customers that have been assigned. So you can see, in this case, Sid was assigned on March 16th at 10 a.m. And then you can click on Sid's name, and it would go to his profile so you can see his information. Okay. And Dee or anybody stop me if I need to go back on anything. The progress page is you'll see we have profile, progress page, iStep, and so forth. The progress page is where you can upload that initial 2151 form. And again, that has to be done within 48 hours of the initial appointment. And so, the appointment will be set using the calendar, so we'll know that date. We can have it set up so you'll see a filtered list of who you still need to, if there's anybody that's past that time, we can have that set up in a dashboard as well. You can also indicate if the customer never showed up for their appointment. That will be really important because that means that the DHS caseworkers need to follow up and do whatever the process is for making sure that that person is doing what they're supposed to be doing. And then we'll have the training program assignment. So it'll go ahead and default to the program that they've been assigned to based on the review process and so forth. Now, in many cases, you as a CBO have multiple training programs. So after you do your initial, assessment and working with them, if, the recommendation really, if the person would fit better within another training program for your community-based organization, then, you can switch them over to another training program. That's not a problem. If for whatever reason we hope that this doesn't occur, but if there's a bad, a referral where it's just not really a good match, then there's going to be an employment services option that's available. And then if it's just something where they just really should be assigned to the customer to a different CBO, there will be a flag for that too. So we can work with you and that customer and DHS to get them assigned to a different CBO. Then on an ongoing basis, as part of the requirements with working with DHS, is the 2151 Form A. So I'm not sure how familiar some of you are with these different forms, but with the 2151 form, that's the initial meeting. And then we have the 2151A form. And that's where you'll have to, go do if there's any change, or if you need to, you recommend them for sanctioning, or if there's, for any of these monthly updates, then then that will be available on their progress page as well. I've included in the document the 2151 form, and so what we are going to be doing, I'm sure we'll need to work on this a little bit, finessing this, and so what we'd like to do, instead of having you have to fill out this form every time, is to use any information that we already have in the system to automatically populate this form. And so the remainder of the questions would just be like completing an online form, and then you just save the information so that it's just here. So if you click this, 5/1/2016, you would just see, all the information that goes in the form, and then it could be printed out in, this type of PDF format, downloaded and printed out. And then the other item that we will have is an enrolled customer dashboard. And so you can see that we use our standard color coding. One is just for information. White is just for information only. Yellow, these people need to have some type of an action, and this will be coming from, that combination of that appointment calendar and the information, the updates that are provided through the progress page, so we know if they never showed up for their appointment, or if we just need to have that 2151 form updated. And then these would just be the items that would be used on a regular basis. And so we still need to kind of, nail these down exactly what they need in this enrollment dashboard. But the main point that I want you to get from this is that we will have a dashboard that you and the DHS staff can use as a communication tool to identify exactly where people are, and ensuring that the communication process, like for the monthly communication, is staying up to date and available. So those are some of the tools that will be available. Any
Natasha, could
yes.
you walk through the process again of accessing the dashboard and how they find the clients that have been referred?
Yep. Let me get my screen share back over. Where did it? Okay. So I'm going in. This is regular WorkNet, and you go to illinoisworknet.com. You'll have two options here: log in or sign up. So you log into your Illinois WorkNet account. Once you log into Illinois WorkNet, you click on My Dashboard. You go to your Partner Tools, and you'll see up here at the top, Employment Opportunities, Personalized Services, Individual Services, and Career Planning. So this is EPIC. So if you don't see this, then you need to let us know right away, and we can make sure that we give you access to these tools. So you'll click on this link, and then once you do that, then you will go to, I'm on test because I don't want to put real customer information on the screen. So I click on EPIC. When I'm logged into my EPIC tools, it will default to show me the customers that have been assigned to my organization. So we're just pretending that these 3 people have been assigned to my organization. I'm going to click on their profile, and I'm going to make contact with them. So I'm going to, first of all, you can call them. You can, if you can't get a hold of them with that, then you can send a letter, sign up, request an appointment. And once you do make contact with them and with that first appointment, then you can help them set up their email account. Many of them will have an email account, but there are some that will not. So make sure that they have an email account, and then just stress to them how they need to check it on a regular basis, because they will be able to receive messages from the caseworker, career planners, and as well as the system for messages and notices and that type of thing. Also, it's really a useful tool for password recovery if they happen to forget their password. We have other options, but we want to enable them to recover their own password. So we get their email address set up, and then they will need to update their Illinois WorkNet account.
And then from this information, you'll have a lot of information based upon the application that they filled out and their not-to-key scores with us, this also. And like I said, internally, you guys are going to be doing a lot of your own assessments with these clients. What we established, we had to have some sort of a process for referral, so we're making some sort of a quality referral to you guys from the DHS offices. So we use the information that you guys provided us in your applications regarding baseline requirements for specific training programs, along with the not-to-key scores, and then information from their application. So like Natasha said, if they didn't have a GED or high school education, and they scored really low on their not-keys, and they probably would potentially need a bridge program to access services. So we're using all of that information to try and make as best judgments as we can on referrals to your organizations. So the individuals are selecting specific occupations that they want to go into, and then from those occupations, then we're aligning them with CBOs. So outside of Chicago, there's pretty much one provider in every area except for in LEN 19, there's 2 providers. So outside of Chicago, the organizations have, one organization has multiple training programs they can put them into. So when they come to you, they're coming with an assumption that they're going to go into, say, a manufacturing program. And then when they reach you, then at that point you'll do your own internal assessments also and determine, is this really going to work for them? Are they going to be able to accomplish this program? Do they have all the entry requirements that we need? So you'll be doing your own assessments. And if you find internally that there's just absolutely no way this individual is going to make it in manufacturing, but they may be able to do something in, say, healthcare or hospitality, they can be realigned to those if it's a choice that they want. They've been given 3 opportunities to choose their interest of what they want to they would be interested in and being trained in. Now, in the city of Chicago, this is going to be it's going to be trickier for realignment because a lot of the providers in Chicago service one specific sector. So there's going to be some more work that's going to have to happen in the city with realigning because we'll have to move between CBOs. But every organization should at minimum provide employment and placement services. If a client just basically says, I don't want any of this, once they're in the treatment group, they're in the treatment group. So if they come to you and say, I'm really not interested in any of your training programs, I just want a job, then that's, you have to provide the employment opportunities for them with that. But like I said, this is a pilot program. We're establishing the system kind of as we go also. And we have 2 months of testing. So there's going to be a lot of things that's going to come out of this that potentially is going to help us, down the road, and especially as we start developing stronger relationships with DHS and bringing DHS into, the workforce system. So, some of the things that are going to be evaluated is, are we making good referrals? What do we need to do to change in the orientation process to make sure, who the people we're sending to the CBOs are pretty good referrals for you guys. And when we get to the, when we have our grantee meeting, part of what we're going to be doing in the afternoon is discussing that. So like I said, once again, this is, we're going to have 2 months of testing here. It's not going to be a home run right out of the gate. But, as we get down, the road, we really want to refine this entire process, and we need you guys' help for that too. So, Natasha, anything else you need to cover?
No, Jeannie had brought up a good point just to show you, and you have access to this information as well, that, when you look at the profile, you'll see their application information, and Tammy, you touched on this too, so you can see how they answered the questions. You'll also be able to see the eligibility review, and again, this is on test, though. In production, you'll see that all 3 people have checked off on these items. 3 people have reviewed it. And then you can see which programs were not recommended and why. So that information is available. And then that's mainly it for right now.
Okay, so let's see if we have any other questions that weren't answered. Mike, I hope I answered yours. And once again, you're going to be doing your own assessments. And when we have that meeting on the 18th, we're going to refine to make sure that our what we call hard stops are really good in the system. So an example would be if somebody wants to, they put as their first interest is to go into CDL. They want to go into transportation, and they want to get their CDL license, but they don't have a license and they've got DUIs. There's no reason to even refer them to that area. So we want to make sure that our hard stops are good and legitimate on our referrals. And once again, the bridge programs are very important for this population, so that in doing those referrals, if we feel like that there's remediation that's needed, we want to make sure we're sending them to the organizations that have the capacity to serve with remediation. So let me see. And so I know there's some questions regarding the workNet and accounts. You do need to determine who of your staff you want to have access to the information, client information. And like Natasha said, you need to go and establish an account in Illinois workNet for these individuals, and then send them. Do you just need the names of the individuals, Natasha, who has you want to link into
Yeah,
your
it's in the
system.
instructions that were sent out, but they need to have the agency name, staff, person's name, and then their email account, their email
Correct.
address.
And we've already have had referrals, and I know some of you I've talked with. We have, I think, 14 referrals so far to CBOs, and I can tell you we've had one to Inspiration Corporation. We've got one, two, 5 to Phalanx Family Services. We've got 1 to Asian Human Services. We've got 2 to National Able. We've got 1 to Rock River Training Corporation, 1 to Jane Addams, 1 to OAI. We've got 2 to Instituto, and then 1 to Central State Sears. If, that you guys need to take a look, get into the dashboard, take a look at this information. It's my understanding DHS office is going to be reaching out to you guys also, and the clients will come with a 2151. But it's on your shoulders too. It's your responsibility to start, reaching out to these individuals too and engaging them and creating appointments. And once we have the calendar set up, it's going to hopefully be a real seamless process, because once they leave the DHS office, they'll leave with their 2151 with their calendar date of when they're supposed to come see you, and it's already going to be on your calendar. So that will be coming here real soon, but that will create a real, hopefully, seamless process for the referrals to the CBOs for you guys. So if you have any questions, please continue to type them in the chat pod, and we'll respond to the questions as we're going along. But what I want to do is jump back to the Program Procedures Manual because we weren't able to actually go through this on the screen. We weren't able to connect last week. In the downloadable files, please download all 3 of those files. We have the Procedures Manual, and we have the instructions for what Natasha went over. So download all of those files. Now, the Procedures Manual is a draft format right now. I'd like for you guys to take a look at it, go through it, read it. If you have any questions, any concerns, I want you to respond back to me by next Wednesday. I want this to be a final document by the 18th when we have our grantee meeting. So it's out for review right now, but I want to get it in you guys' hands so you have an idea of what we're looking at, and you guys have an opportunity to comment on this also. It's broken out into different areas. The first part is basically the description of the program and background. I'm not going to go through that. That particular part is information you've already seen and heard. And some of this is in the RFA also. So it's just giving the background of the program, the targeted locations, which we're very familiar with right now, your targeted sectors, and then the participants that we're serving. There is a Category 1 and Category 2 for this, and I'll get into that as we get down a little bit further. But the distinction between a Category 1, especially an individual that's working pretty much full-time, 30 hours or more, is whether they are a work registrant or not. And we can get into that down a little bit further. But it just goes through your partner roles again, making sure you have your established partners. So I'm not going to get too much into that. Now, on the program design, we kind of go over what the intake process is. Read over this. This is DHS's front end. So this is their outreach and intake. Excuse me. And it's just explaining their process of what they're doing to get these individuals in and how we're engaging them in the process and then referring them to the CBOs. And I said, once again, one of the critical things that we put in the RFA is bridge programs. So clients will be referred to CBOs based upon, if there is some remediation need also. So, and then like I was talking, we have, and this is modeled after the JTED program, we have a Category 1, which is employed, and then also a Category 2, which is the unemployed or underemployed. Now, in Category 1, we have like the A, and that is the individuals that may be working 30 hours or more. They're not considered to be work registrants, and they would be volunteers into this program, which means if they, if their income is low enough that they can receive SNAP benefits, but they're working 30 hours or more a week, so they don't have a work requirement tied to them, and they would volunteer for this program. Now, the clients, I want you to know the categories and who these people are, but you're getting these clients from DHS, so you may have no control of how many, or what style of clients are potentially coming to you. But with the Category A, we can only have 15% that are non-work registrants. So that's why I'm telling you this information, that you could get individuals in your organization that are working, but they're low-skilled and underemployed. They're not making enough money or in a career track, or they don't have enough skills in the specific occupation that they're in to be able to get off public benefit. The other category of the employed is those that are marginally employed, so they may be working under 30 hours, part-time positions. They may or may not want to stay in their current occupation. So you'll be getting people like this also that may be working 10, 15 hours a week, that either want to continue in that particular area, and that's why they were placed with you, if it's, say if it's hospitality, but they want to upgrade their skills so they can become full-time employed in hospitality, then that's the CBO that they're going to. But these are considered to be work registrants, and so they have requirements that go along with the work registrants part of it. And on the 18th, we're going to go through all of the definitions. I'm not going to spend a lot of time on the phone on this because there's a lot of nuances with this regarding voluntary clients and mandatory clients and who can be sanctioned and number of hours that they can work and all of that. But there's just a lot of that information is in this too for you to take a look at. For Category 2, unemployed and underemployed are the predominantly the long-term unemployed individuals. This is where a lot of the ABOD population is also going to be coming through, and that's able-bodied adults without dependent children. And that is one of our targeted populations that we're serving under this application. So in this particular case, these people in all counties where there are employment and training services, they are mandatory, and then they could be sanctioned individuals. So like I said, I'm just giving you definitions of this. When we start going through this on the 18th, we'll go more in depth of what that means. Once again, employer engagement and work-based learning, we want to make sure that you have your employer relationships in line. For two purposes. We want to be able to provide work experience out of this grant, which I think most of you, I maybe have just a couple grantees that aren't going to do that or haven't budgeted for that. Most of you are providing that, which is a key element. And then also the employer side of it, where you have permanent placements. And ultimately, what we want to see is potentially the work-based learning, work experience transition into permanent employment. So that's the A+, I guess, that we want to see on that. And I know it's not always going to happen, but that's kind of the relationships we'd like to see established. Industry recognized credentials, and we've discussed this. One of the things we want to build out through this program is using the DOL competency models and developing these career lattices where they may not be defined very well yet. So those are the things that we're going to be developing through this program also, is those career lattices. And those are going to be incorporated into Illinois WorkNet, into those in the future with that. So we'll discuss this also on the 18th, but we want you to keep in mind that we want to start looking at the career pathways and developing career lattices, regardless, whatever occupation they're in. I know we've got a lot of those somewhat developed with the 9 sectors that are in the Illinois Career Pathway section. We need to develop those out a little bit better for the hospitality administrative support sectors. So that's one of our functions with this project too. And then, of course, the accelerated and enhanced training and the work-based learning. I think, a lot of you guys are working with community colleges that have bridge programs. That's one of the things we wanted to make sure that you have an established bridge program that's recognized by ICCB that you're working with, and you have to work with ABE, is certified through ICCB, and they have a list of those colleges and not just colleges, but providers that do adult basic education learning. And, from what we've seen, you guys are on target with what you've got there. So just the training activities, once again, we're going through the models. There is coding in the system that will identify what model they're falling in. And this is something else that we'll be working on the 18th also. We'll break out into sectors. but we want to make sure that if each organization that may be dealing with transportation, we're kind of working with the same industry recognized credentials, and we want to have some consistency, obviously, in our training programs. So like the Model 1 is bridge programs, and bridge programs specifically is going to deal with ESL and reading and math and bringing them up to an 8th grade reading level. And then your Model 2 is going to be, your ABE training, and then some career and technical education training, and we're defining exactly what else is going to fall on that here too. And that's one of the things we'll be working with on the 18th also. And then your Model 3 is going to be, your higher level industry recognized credentials. So this model structure is pretty significant to our evaluation team, and they kind of want to know where people are falling in the model structure. You guys are not going to have to do any identification on that. It'll be based upon services and activities that are provided under the work programs and how they're coded. But that's just to give you some information on that. And then your work-based learning, once again, I said that, that's a key component of this. Work experience is paid out of this grant. If you can co-enroll, and that's great. If you have a WIOA program that you can co-enroll in with and pay for the training out of this one and provide an OJT as WIOA, that's phenomenal. And that's one of the things we want to establish with this too, is those linkages. So we can get these individuals linked into the WIOA system and start accessing those higher level credentials once they complete this training program. So, they can go, to an RN program. We won't be able to, obviously reach that with this, but if we can get them on that pathway, then that's a very good positive outcome. And then, of course, your supportive services. Like I said, you can read through this. Supportive services is allowable cost in this. There's documents that we have, that we're going to be utilizing. And that's one of the things I want you to take a look at, too, on the documents. If you guys have a better document that you think would work, by all means, send it to me, and we could take a look at it, incorporating those. But so your supportive services. Now, one of the things that is available through Illinois WorkNet is an Employment 101. And it gives you the work readiness training here, and these are the components of that. So you're exploring career training, financial literacy, workplace skills, job search. These are all opportunities that you can do through WorkNet. And this could be very valuable for you guys, because with individuals that are considered mandatory, they have to participate in 120 hours a month. They have to participate in 80 hours a month. You cannot make them do over 120 hours per month, but we're going to create a document that they can sign. So if they want to participate in training and work experience over 120 hours a month, all they have to do is sign off on that. So, but they have to participate in at least 80 hours a month. So that's 20 hours a week. So this is a component that you could use with these individuals and bring them in. Obviously, locally, you've got your systems that you have established to dealing with work readiness and education and training. But we need to make sure that the mandatory population is meeting their requirement, their time requirements in this program. And part of that can also be community service activities. So there's a lot of different ways to make sure that they're engaged and meeting those hours. I'm anticipating most of it's going to come from work experience and training, but there is work readiness that we need to do also with that, and there are other opportunities, like I said, with community service or even unpaid work experience. Once again, employment and retention, this is key to us. We're going to track it 90-day retention with this application or this project. Program administration, read through this. There's some key components in this related to just generally running the program. So make sure you look at the program administration section. I'm not going to go through these each, but there's some key elements in this. And like I said, this is a draft mode, so we could be adding some additional information, but it talks about, once a client appointment is made, you have 48 hours to get back with your DHS office using the 2151 referral form and indicating the status of that client. So you've made the appointment with a client, they're a no-show. Then you have to indicate on the 2151 that they were a no-show. Our process we're establishing is that you're going to upload that into workNet, and the DHS caseworker can grab that document. Hopefully you're not going to have no-shows, or if you have no-shows, and you'd have to say, okay, we reached out to them, their car broke down, they couldn't make it to the appointment, we rescheduled another appointment. So, that's one of the key communication tools and one of the documents that DHS requires, along with the 2151A. So once the engagement has been made and they're starting services, then the 2151A is something that will be uploaded on a monthly basis, just indicating their engagement, that they're currently engaged. So once again, EPIC is also a performance-based, and we're basing the performance on the 4 measures of enrolled in training, completed training, employed, and retained for both categories. This is a little complicated, and I don't want to get into this too much on this phone, and we will cover this on the 18th also. But you look at this page here as far as how it's going to be, performance is going to be graded. When you guys submitted your scope of works, we took your average cost per client, and we took 20% for employed, or 20% for enrolled, 30% for completing, 30% for placement, and 20% for retained. And we attributed that average cost for each of those measures based upon that percentage. Now, on that form, and I had a lot of questions on that, if based upon our negotiations, what you said you could do, and you meet all your performance measures based upon that, then you've earned your money. If you fall short of any of that, then the disallowed cost is any of that shortage. So it's a little bit different if anybody's done a JTED. It's not done the same way as that. So it's based upon the shortage of what you've missed. The reason for this analogy is because you have no control of how many clients you're getting in, and the funds are going to follow the clients. So this was a clean way of having a performance-based system when the only constant is the average cost based upon what you guys have provided us. So like I said, once again, on the 18th we can go through that a little bit more. And if you have any questions on that, just please give me a call. So allowable costs, this is something that was in the RFA also. This is something you need to share with your fiscal staff. We have requirements related to that. Once the grants are established, which is soon, I know that was one of the questions, I've got the scope of work language approved from legal, and the 4.4, which is the program-specific language, is hopefully going to be completed this week. So we are moving grants now. By tomorrow, I'm hoping that we're going to be sending out the scope of works with your information that we negotiated in it for you guys for one final review. Another document I'm going to be sending to you is a location document. So basically, where exactly is the location of the training programs, where it's going to happen at. So like an example is we may have an organization that's serving DeWitt and Macon County. Now, where is the location of training, in Macon County and in DeWitt County? Or, we need to identify exactly where the training providers are located. So that will be something that you'll get with that also. Once again, we're providing you with and if you had a summer youth, this is going to look very familiar. We have the employer partnership worksite agreements that we're providing you with, and the structure of that. Our reporting requirements, if you've had a grants before, you know what those are about. We are going to have a report that's going to be required quarterly. That is the research team report, and it's a cost data report. It's going to be an Excel spreadsheet that they're putting together for us, and they're going to pre-populate as much as they can on that. But basically, it's going to collect, all of the data on cost. And that's something that we'll be able to go over on the 18th with you guys also and provide you, hopefully by then, that we can provide you the actual file for that. But that's something that the research team is going to be using to determine, the cost-benefit of this. And then, of course, supportive documentation for our report is a trial balance. So I'm kind of just going to fly through this. All of this is information that you've seen before. If you've been an employment and training, the summer youth grantee, this is information regarding payroll distribution and our final reports. So take a look at this. We have all of the attachments. We've got the map in here showing up, the distribution. once again, as I said, the money's going to follow the clients. So if we have, say, down in Elwea 25, and they're just, they're doing great, they have the demand down there. Right now we're showing them 98 in the treatment group. But if they really have demand and they end up serving 120, then that's fine. We're going to, the money's going to follow the clients. And we're putting the grants out, like I said, at 50% because we want to be able to give you money and not have to take money away. It's a long process to deobligate. So grants will be started at 50%. And as we progress and you need your grants increase, then we'll modify more money in. This is, once again, this is in the RFA and just kind of the flow of what we want to see, being developed in this project. So I'm not going to go through each of these documents. We have a worksite agreement form here that you can use. We have worksite assessment forms that can be used. I'm not going to go through any more of those at this time. You can take a look at it. But what I would like for you to do is get back with me by next Wednesday. If you have any comments on this, please send me an email and let me know what your comments are. Don't worry about any spelling or formatting. That will all be corrected in here. But any content that you think or you might have issues with, just please, let us know and get back with us. Okay, and that is the procedures manual.
There were a couple questions from David, like what's considered a billable employment placement. And Jessica had a question. I don't know if you see them in the chat pod.
Billable employment placement would be a placement of an individual with an employer at full-time, which is considered to be 30 hours. Enrollment's an easy one. I mean, enrollment's kind of a given. We wanted to put a little bit more emphasis on completion and placement. And then we have a little less on the retention side, too, because retention for this population is kind of tough. And I know I talked with several of you guys. We created a retention at 55% of enrollment, which is a high measure. And we realize that. That's pretty aggressive for this population to have 55% of those enrolled retained. But we want to set a high standard at this point, and then if we need to look at adjusting some things on the back end, we could potentially do that. But we want to make sure that we're, this is a very critical program for you guys. I mean, you guys have probably 90% of the funds, 95% of the funds. Most of the money is coming to the CBOs. So this is very, very important, and it's very significant nationally. So we need to really pay attention to this, and we need to really work hard on this because this is going to probably change the way employment and training services are offered, not only to potentially maybe SNAP participants, but maybe TANF participants in the future. So, I mean, we really need to, this is significant, and I really want you guys to take this program serious because, I mean, there is some potentially really good opportunities that could come down the line, in the future. And one of the things we're building in with this is the ability to, there's no match funds required for this program, but we're going to track it because through DHS, and I know our liaison with FNS wants to see Illinois go for the 50% match, which means an example would be if a CBO uses in the EPIC project and they're a cost for the participant, say they put $3,000 from EPIC into supporting that participant, but the actual cost for the services of this is, say, $5,000. So $2,000 is coming in from maybe state money or maybe coming in from foundation money or, local money, private money, whatever. That would be considered a match. And we're working through the details on that, but to make sure we're documenting it correctly. But the federal government can provide a 50% reimbursement for that match. That's anything that's non-federal money. And that could potentially be significant because I know there's, CBOs out there that have, some pretty decent matching money that's non-federal money. So that could be a really huge sustainability opportunity for this program. But not just that. I mean, I think the face of how employment and training is being done for SNAP participants is going to change. So this could be a real driving force for that. Okay, any other questions? Sorry, that was kind of long-winded. Okay.
I saw there's one, and if you've already answered, I apologize. Alora said, will the work experience agreement be the same one currently used with DHS?
The work experience agreement. We've got a work experience agreement in our manual here, and it's because with DHS, theirs is a non-paid work experience. So take a look at the one we've got in our manual here, the work experience agreement that we've got in here. Like I said, and this is still a draft form, so there could potentially be some changes based upon information that we get from you guys and other sites. So, but the work experience agreement will be in the final manual that you're going to be utilizing. So with that, I think the next thing on the agenda was to discuss the grants. And like I said, I'm working on the scope of works to get those out to you tomorrow for your final review. We're loading up the applications and everything we need to do in eGrants to start pushing that. I met with our legal staff today on the 4.4, which is the program-specific language, and that's being finalized. So once that's complete, we are going to be pushing grants. This is a priority. So we'll be getting movement this week, and then starting next week. So I'm hoping that we can have something to you guys within the next couple weeks. I'm saying at the latest. I know this is a big priority. We want to get the money out to you guys in the field because you guys are starting, and we have to accept clients because they're being referred to us. So, and I know you guys are used to working with the government, and especially if you work with JTED, we would have grants established, and it'd be like 6 or 8 months before you even got your money. But this isn't going to be like this. This money's coming out, and this is a push to get this out as soon as possible. But we want you to start your programs. We want you to start accepting these individuals, and those that have been referred, you need to reach out and establish appointment dates for those individuals being referred. And we have orientations going on now every week. We're having a random assignment happening weekly. So our list is going to get bigger and bigger. So we need to make sure that we are engaging these individuals. And then the last thing I think on the agenda was the meeting on the 18th. I am going to have an agenda out to you guys, but basically the structure of the 18th, the CARE program has graciously offered their place in the morning, and we're going to go through their morning motivations, which is a really, really cool experience. So if you haven't been to the CARE program to see that, it's going to wake you up, that's for sure. So you need to be there between 8:15 and 8:20 at the 8:15 to 8:20 at the CARE program. The motivation starts at 8:30, and I think that runs for about a half an hour. So then after that, we'll have introductions. Julio Rodriguez, and I'm hoping Diane Grigsby will be able to be there with DHS. And then we're going to have you guys go through an orientation. So a gentleman from the Chicago office who's very dynamic is going to come, and you guys are going to be the SNAP recipients. And so he's going to walk through what they're going through on the front side, so you have an idea of how these people are getting sent to you. And then, of course, we're going to go through the procedures manuals and explain, because you guys are also considered to be providers for DHS, SNAP ENT. And then so there is some policy that's different based upon this EPIC pilot project and some that's similar, so we'll do a crosswalk between those for you too. So you know what applies based upon the SNAP ENT policy and then what the EPIC policy is, and so we'll go through that. And then in the afternoon, we're going to be going over to, unless it's on your own, sorry, we can't do that, pay for that, but there's a lot of places to eat around there. In the afternoon, we're going to be going over to the DHS offices, and we're going to do some breakout sessions. And we're going to break you guys out based upon sectors. So there's some information that we want to collect from you guys at this time, too, which deals with, are we collecting the baseline information correctly? Based upon that, are we making good referrals to you guys? We need to start populating in workNet activities. So you have your specific work programs that you're offering. So what are the activities that are aligned with those? And based upon that, what are the credentials that are going to be earned from that also? So that's something that we're going to start coding in our system with that too. And then the other thing is too, we want to make sure that what we're doing is in sync. That these career lattices that we're developing are industry standard lattices, and that that we're kind of all on the same page. If we're offering, a hospitality program, that we're kind of talking the same language, with that, or if it's something in manufacturing, we're talking the same type of language, with some of that. So then we'll have breakout sessions with that. And then, that will pretty much do it. So is there any other questions, concerns that anybody has right now? There's just a lot of information you guys are going to get here. We will be establishing a training session in Chicago that will be in a computer lab to go through the workNet, because there's going to be a lot of components in that. So we will have all of the Chicago staff in Chicago, and I think what we'll probably end up doing is try and have Rockford come over to Chicago, and then we'll do a training central location and then a training down south for the CBOs, so that we can get you into the workNet system, and you can see all of the variables and everything that's available to you, and what you're going to have to do in that, because that is our system for tracking clients and exchanging information. Okay, let's see here. Okay, we're planning on quitting on the 18th around 4:30, because I know people have to travel, and getting out of Chicago can be sometimes challenging. So I think we're going to definitely try and end the session by 4:30 on the 18th. Yeah, and the letter of intent, we had a question on the letter of intent, and I have communicated with some individuals that need a letter of intent, and I will get a letter of intent out to you. I was hoping to be able to do that by today. But if you need a letter of intent, please send me an email or give me a call, and we will get those out to you. The grants are going to follow here quickly after, too. So let me see, is there any other questions? I think hopefully we've addressed everything. If not, like I said, once again, please feel free to send me questions. There is an FAQ in workNet, and Natasha, would you mind explaining the best way of reporting questions in workNet?
Yep. Let me get them over here. Sorry, let me get my screen share up here. What you can do is we have, it's illinoisworknet.com/, well, this is the short URL, EPIC Partners. Oops. You can get to this page from the short URL, or you can always access it from the footer under Partner Resources and look for the EPIC tile for the EPIC Partner Resources. One moment, I got to clear my throat. Okay, and we do have a full list of resources. We have tutorials. I know that one person had said, well, what's the process like on the front end? So you can see we have a listing of tutorials that have already been put together for the DHS staff. So if you would like to see that, you can see that. We'll continue adding the archived webinars like the one that we're doing today under archived webinars. And then, as Tammy mentioned, the frequently asked questions. You can select frequently asked questions and click here to submit your question. Or you can always send it to info@illinoisworknet or epic@illinoisworknet.com. We have multiple options.
And you can see there's quite a few questions that have already been answered in that. A lot of them deal with the front end of it. So I anticipate we're going to get a lot of questions from the CBO side of this here coming in too. But yeah, please.
I mean, so like Tammy said, we have a ton of questions, but there's also, filtering options that are available as well.
Okay, thanks, Natasha.